Hi, my name's Leah. I'm going to be demonstrating IV catheter insertions. First, I'm going to check my orders and make sure that the provider has put in an order for IV insertion. Then I'm going to check my supplies. I have my IV starter kit, extension set, then my gauge. I'm going to check with the orders in case that the provider put what type of gauge he wanted the patient to have, but I have a 22 gauge here, and then I have my saline. I'm going to knock on the door and I'm going to say, hi, my name is Leah. I'll be your nurse today. I'm going to wash my hands, put my gloves on, and then I'm going to identify her. For your name and for your safety, can I get your name and date of birth? So she's going to tell me her name and date of birth. I'm going to verify on her armband or in her Mars. And then I'm going to explain the procedure. I'm going to be placing a catheter into your arm for you to receive either IV fluids, whatever the doctor's ordered, like IV fluids or IV push medication. So then I'm going to ask her if she's had a mastectomy, a fistula, any stents placed in either arm. I will look for a band that might indicate that, but I'm just going to ask her just to make sure, because I want to avoid the arm where she has the fistula or where she had the mastectomy. I'm going to avoid that area as well. So then I'm going to provide for privacy. I'm going to push the bed up to a workable height, and then I'm going to put her in Fowler's or semi-Fowler's position. I'm going to lower this side rail that I'm going to be working on, and then I'm going to make sure the opposite side rail is up. And then I'm going to place this chuck underneath her arm to ensure that no blood will get on her clothes. So once I have her positioned and I put the chuck under her, I'm going to go ahead and open my IV starting kit, and I'm going to pull out my tourniquet. I'm going to place the tourniquet just where her biceps ends. I'm going to place it like this. X. And I'm going to put it under like that. I'm going to select my vein starting distally and then moving proximally. I'm going to avoid any bony prominences, any moles, any rashes, any markings on the skin. I'm going to look for a vein that's plump without any valves, possibly one vein that is straight. So this is the vein I'm going to choose. And then I'm going to undo the tourniquet. I undid it. So once I've done that, I'm going to go ahead and open my extensions tubing. I'm going to go ahead and get my extension tubing ready. And all the stuff that I need ready. So I'm going to make sure that this is sterile, or as sterile as it can be. And I'm going to attach my saline while keeping the tubing still inside. And I'm going to flush it a little bit so I can see where the saline come out of the top. Then I'm going to take this part and I'm going to loosen it just enough so that it's okay. Then I'm going to go ahead and clean the area, pop this, and then I'm going to move inward, out, all the way. And I'm going to make sure that it dries completely. While I'm waiting for it to dry, I'm going to get my tape ready. My techoderm out, and then also that. So I'm going to tear off my tape. Get that ready. And then I see that it's dry. I'm going to replace my my tourniquet. You can see it right here. I'm gonna avoid crossing over this part too. That's what you want to do, because you already sterilized that. Then I'm gonna check for a radial pulse. So the radial pulse would be over here because this is the hand, and I still want to be able to feel the pulse. I'm gonna open my needle. I'm going to go ahead and look at this needle and make sure that it's not broken. There aren't any breaks in the catheter. And then I'm going to go ahead and I'm going to feel for this. And I'm going to pull just slight traction distally of the vein of where I want to put the insertion. Make sure the bevel slides up. And I'm going to come in at a 15-degree angle. Once I see a flash return, I'm going to go slightly, so I'm not going to puncture the other side, and I'm going to advance the catheter forward. And I'm going to hear the click. Once I've done that, I'm going to let go of the tourniquet. And I'm going to occlude the vein distally. And then I'm going to go ahead and I'm going to turn it while I'm avoiding the IV site. So it's right here in my hand. I'm going to put it safely. And then I'm going to take that off. And I'm going to go ahead and put that on. So without touching the site at all. So once that's on, I can let go of the vein, but still hold on to this so it doesn't come out. And I'm going to slowly push in. And I'm going to slowly pull back. And I see blood return. So I'm going to go ahead and put that right there. I still want to hold on to that in my tape. And I'm going to put my tape over so it's not going to touch the tetraderm or be in the way. And so now it's semi-secure. I'm going to take my tetraderm, make sure not to touch the middle. And I'm going to put it over the blue part only. Over the blue part only. Then I'm going to take off the sides. Make sure that's that way. Then I'm going to go ahead and put my label on. I'm going to put the date, the time, what gauge it was, which was a 22, the initials. I'm going to go ahead and clean my area. If I need to put a cap on, I can put a cap on this, or I can start the IV if that was ordered. But for now, I'm just going to leave it on there. And then I want to make sure that I look at the site, make sure that if there's no swelling or redness. So once I place this sticker on the patient and put the date, time, gauge, and put my initials, I'm going to go ahead and educate them on the IV and tell them to notify the nurse or any one of us that if the IV site is red, if it's irritated, if it's cool to the touch even, if they notice any drainage from the site. I'm going to also want to educate them on not getting their IV tangled. A big thing to look out would be their phone cords, if they have phone cords in the room, so it doesn't get tangled with the IV. Make sure that their phone is on the table instead of on the bed with them if they're charging it. Make sure that they move with the IV pole, or if they need assistance with something that they call if they feel like they can't move with the IV so that they can get assistance. If they need to take a shower or go to the bathroom, and they need to be disconnected from the IV bag that's hanging, to please let one of us know. I forgot.